Hi everyone, my name is Dr. Joel Rosen. I am a board-certified chiropractic physician as well as a graduate of the American Functional Neurology Institute and Functional Medicine University. I want to continue on from where we talked about last time. I also urged you that I wanted you to print off a questionnaire so that this would make this whole video series a lot more relevant to you, because if you circled more than 5 yeses on the last neurological assessment form that we talked about, then you'll know that you have some kind of at least brain connection with your thyroid that needs to be addressed. The next thing we're going to talk about is the metabolic assessment form. On this, you have here listed your 5 major health concerns in order of importance. And then you have different categories. I want you to circle all the different numbers that apply to you for each category. And today we're going to talk about category number 1. Category number 1 has to do with colon health. So what that means is if you've circled anything that has 1s, 2, or 3s, then you potentially have a colon problem. Things like not emptying your bladder completely, lower abdominal pain, alternating diarrhea and constipation, coated fuzziness on the tongue, past large amount of smelling gas, more than 3 bowel movements daily. Anything that you've circled 1, 2, or 3 with, then you have a colon problem. So what I want you to do is I want you to write out colon. Now, what happens in the colon and why can that affect our thyroid is your next question. That's a good question. The reason why the colon is important is because basically the colon is the last part of our gastrointestinal tube, and basically what happens is the colon is necessary for absorption of fat-soluble vitamins, which are A, D, E, and K. It's also necessary for water absorption, and it's also necessary for sodium absorption. But more important than that, our colon is lined with what's called a normal flora of bacteria. And if that normal flora of bacteria is overridden with unhealthy bacteria, then we have something called dysbiosis. And with dysbiosis, what basically happens with that is we have too much unhealthy bacteria to too much healthy bacteria. And then we have potentially bacteria infections, we have viral infections, we have parasite infections. I can't tell you how many times I have people coming into my office that have all these different infections, and that's creating inflammation in the body. And when that creates inflammation on the body, that starts to create a lack of fuel. And remember what we talked about, where in the last one, we talked about your brain needs an optimal amount of fuel to be able to signal the thyroid to release its hormones. So indirectly, we're starting to have not just a thyroid problem or a cold problem or hair problem or energy problem. We're also having a brain problem in terms of fuel and activation, and we're also having a colon problem in terms of absorption and having the vital amount of nutrients to help the whole engine work. So hopefully you start to understand that this is making a little bit of sense for you. I look forward to seeing you on our next video. Thank you.